Really appreciate it. My name is Dr. Zweli Mkhize, I'm the spokesperson of the Minister of Health. I think we're all going to have a very special bond after all of this is over. A special welcome, of course, to our Honourable Minister, Dr. Zweli Mkhize, and I would also like to welcome the MEC of Health in Gauteng, Dr. Bandile Masuku, and of course to welcome from the National Health Laboratory Services CEO, Dr. Kami Chetty, and of course Prof. Eric Buch is also here with us as well. Without much further ado, I will invite the Minister of Health to address the nation. Thank you very much.
Thank you very much, colleagues. Just to acknowledge the colleagues who are here, MEC Dr. Bandile Masuku, the chairperson of the NHLS, Professor Eric Buch, and Dr. Kemi Chetty, the CEO. We've got a few colleagues who couldn't be able to join us because of the short notice with which this was arranged, like the Deputy Minister and some of the senior managers in the department. We've got too many meetings, and we do get into a lot of stuff that runs in parallel. So I hope that you will understand, and I want to thank you for being able to adjust your times and be here at short notice. Firstly, let me start by conveying our shock and sadness at the loss of Professor Gita Ramji, one of our top researchers, vaccine researchers, and one of our very topmost HIV prevention research leaders, who passed away yesterday and had come back from a conference in the UK and suddenly came back well and asymptomatic, and in a few days developed symptoms and was found to be positive with COVID-19 and therefore has passed away. It's a real shock, and it's serious, a very a severe blow on our scientific community. And we want to convey our condolences to the husband, to the family, to all friends and colleagues for a very sad loss. Our professionals, our scientific community has really been dealt a blow by this loss. It does go to show how serious this problem of COVID-19 can be, and also that it can affect anybody. And she would have been amongst the last people would have thought could have been affected because all of us do know about this infection. However, the nature of its spread means that it's very easy to be exposed. I think her passing away leaves us all the poorer, but also it creates a very real sense of the seriousness of this infection, and I believe it's important for us to acknowledge that we are facing one of the most formidable challenges, and that we need to be taking all the messages about prevention, about containment quite seriously. And so we really want to thank Professor Ramji for all the contributions she had made. Some of you would recall she was part of the team that was involved in the looking for a topical antiretroviral solution ointment to be used, of course, by women, which was an intravaginal ointment. Of course, that test was quickly abandoned because it was felt that it wasn't assisting in the improvement of the safety of the individual, but a huge amount of scientific knowledge was gained in the process. And amongst the top leaders who the whole country and the global scientific community respects. was Professor Kitaramji. Still in a prime, really, when we expected a lot, we really are feeling very saddened and robbed by untimely passing away. We therefore wish, as I said, to convey condolences to all the friends and colleagues, and may her soul rest in peace. If I may just ask us to focus on the today's issue. Those of you who might have been with me around would know that I always have this clearing of the throat. Now, I must just tell you that I come from an atopic family, so we're a family that's got all sorts of sinus problems, asthma, skin reactions, and so on. So once you change temperature and your air cons and so on, it creates a bit of a challenge. However, we did test for COVID-19 and it's negative. It's negative. I think that's not for recording, that's just for information. Today we want to report the total number of patients of positive tests that we have up to date was 1,380, which is an increase of 27 cases from yesterday's announcement. Which means that in Gauteng we've got 645, in the Western Cape we've got 326, KwaZulu-Natal we've got 186, Free State we've got 76, Northwest 9, Northern Cape 7, Eastern Cape 15, Mpumalanga remains at 12, and Limpopo remains at 14. And to date, we should indicate that 44,202 people have been tested, largely in the private laboratories, but that's equal to 47,541 tests. In other words, that patients tested and number of tests, which means the tests are more because we repeated some of them. Of which just over 6,000 were performed in the public National Health Laboratory Services. This, for us, is way too few for the size of population and the inequality, poverty, and underlying burden of diseases and immune suppression that we have. So even though this number seems high, I'm saying it's still far, way too low for the kind of challenges that South Africa faces. So today we came to unveil a number of mobile laboratory tests, vans. The NHLS has procured 60 mobile vans in addition to the 7 that were currently being used, and therefore it brings us now to 67 mobile testing units in the vehicles which are equipped as laboratories. They will focus on sampling nasopharyngeal specimen for the PCR test, which is what is happening in the laboratories. The current capacity of our laboratories has been pushed up to 5,000 tests in 24 hours in 10 laboratories countrywide. These mobile units that you have seen will also be used for the gene experts, machine equipment for PCR on coronavirus, using this equipment which is currently used for diagnosing tuberculosis. When these tests have been validated, and hopefully that should happen by next week, maybe end of next week, we are pushing quite a lot. And so, as I'm saying, hopefully next week, the NHLS knows that's a deadline that we are actually extending to them. That will move our capacity to about 30,000 tests in 24 hours, using approximately 180 testing sites throughout the country, consisting of 320 testing units. So some of the equipment that you saw that we said these were gene experts, that's what it will do. These mobile units will also be used for rapid test kits when these become available. They're not available yet, and again, having a 24-hour shifts to make sure that that becomes a reality. These will be focusing on people who will be tested in the community with the assistance of community health workers and also the contact tracers that will be that are out there in the community. And for the upscaling of this program, a list of priority districts will be finalized by MECs in a teleconference tonight. That will probably be around 9:30 or so when the teleconference happens. Just in case any of them might have missed it, at least you would get it from you that we are going to have a teleconference. But with the incidence of COVID-19 rising to more than 1,353, and of course we have had the figure today, COVID outbreak has moved from an important traveler-based outbreak to local community transmission, where the Department of Health remain concerned that the lockdown will not be enough and that we need to ensure that COVID cases are identified. To achieve this, a strategy of increased case identification needs to be undertaken that the President announced as the COVID home visit program. That is why we're announcing this today. The program includes, as we said, the deployment of community care healthcare workers to the field for door-to-door household screening, and each province has also been requested to start working on this strategy, deploying their own community healthcare workers, their professionals, as well as with appropriate PPE, personal protective equipment, so as to ensure, I think some of you would have seen how we've gone to the extent of protecting those staff that are going to be working on these units. The CSIR and the Right to Care have assisted us in mapping the most vulnerable population using some of the criteria, 993 strategic priority wards, which have been identified using Social Vulnerability Index. That is how they've actually identified the key wards, priority wards that we need to focus on. But what we'll be discussing with the MECs is to make sure that that identification is integrated with their own what we call hotspots, where they've already identified patients who are positive and contacts. Just to give you a sense of how I personally understand what is going on, I'll quote from you a letter that I sent to my colleagues this morning. So I sent this letter, which was a personal message to the colleagues, the MECs as colleagues and leaders in the fight to save our nation from probably the most devastating enemy that has ravaged many nations and destroyed many lives in recent times. And I sent the note to encourage them to be strong in the face of what may become the worst challenge that our country may face for generations. So I believe that if we're focused, we can actually collectively defeat COVID-19. We've seen a slower increase of COVID-19 positive cases in the past few days, and I'm sure all of you have been noticing that. I ascribe this reduction in the rate of increase to the following factors. Firstly, we closed the borders and reduced importation of the infection. A large number of infections were driven by people who had been to those particular areas that are already affected. Secondly, enforcing quarantine of the inbound travelers and returning citizens has slowed down the infection from traveling community to a resident community. It's been a very strong factor there. Thirdly, the lockdown has slowed internal transmission by reducing the risk of spread through large gatherings, churches, football and festivals and so on, and also overcrowded transport routes such as trains, buses and taxis. However, we need to remain alert to a number of areas. We need more vigilance now more than before. The internal transmission, because of the following issues, the internal transmission has started, and it may have a tendency to spread silently, as people with less means and slight symptoms may be slow to seek medical help, as they are few and far apart. Excuse me. So what it basically means is that those people who might be having mild symptoms, if they're in poor areas, they may not seek assistance immediately. But it's one person there, it's another one very far, so that means they are not actually going to be appearing as a big number of people, as it were. The second issue is that our testing criteria of patients with symptoms is reactive and restrictive. In other words, you have to show yourself up because you have now got infection. That's how we've been testing up to now. This means that we don't have yet a true picture of the size of the problem. We need to test hundreds of thousands of the population to get a better picture to refine our containment strategy. That's why I say, even though we're talking about 47,000 tests, that's still far too low because of the nature of our country and the nature of the disease burden, inequalities, as well as the population size that we're dealing with. This means that people with access to private family practitioners have largely tested, most of whom had the history of traveling into the Western capitals where there are challenges of this COVID-19 as an epicenter, and therefore they were easy to suspect if they got symptoms, because everybody knows if you travel to those areas, even for slight symptoms, you need to come forth. The other thing, as I said, we need to be vigilant, is that the lockdown may have the inadvertent effect of limiting access to health facilities for those who depend on the public services in poor and densely populated areas and other underserved communities because of transport difficulties. This means that the release of a lockdown may have a huge rebound effect on releasing every constraint that made the infection slow down. And we may have a runaway train with no way of applying brakes. That's the vigilance which we must put into the whole situation. Therefore, we need to engage all community leaders and call for volunteers in community and civil society formations to support the campaign against COVID-19, spread the message, and teach our people to take the containment measures more seriously and support all the affected individuals and families. The message of stay at home and the importance of hygiene must be made more emphatically. The message must be that COVID-19 is serious, but can be defeated. And we need each person to make this a personal fight to save our nation. Those on antiretroviral treatment and other chronic ailments need to stick strictly to their medication. Each person's action will count, because we have to break the chain of coronavirus infection. Next month, the flu season will start, thus making more people sick with similar symptoms, with no way of distinguishing common colds from an upsurge of COVID-19 infection. These will flood our hospitals and clinics and create a fertile ground for coronavirus to spread or to be masked in its presentation. This means this small growth in numbers, we may be currently experiencing the calm before a heavy and devastating storm. So, we need to be aware, that there may not be many further warnings before the pounding descends. So there will be no time to prepare what we have not already put in place. Particularly in the next 7 days, we need every plan to be put in place. So my plea to the colleagues, and as I was saying, this was the message I sent. My plea to the to the colleagues was that number one, setting up of the mobile units of health workers to move into communities with cases and contacts set up for testing and screening in communities, initially starting with the symptomatic and then extend to the greater community. So that means that these vehicles must go already to where we've identified what we call hotspots. And then we start with those who are symptomatic, and then we're going to move on to go to areas where we've identified contacts and positive cases. You have heard already that there are cases identified in Alexandra, Khayelitsha, in Inanda, in some of the townships, in the Free State. So that's why we have to roll this out. When the President sent the message, it was because it is important for us to move ahead of the spread of the infection. We will now procure rapid test kits, taking into account any of the flaws that anyone may point out as we roll out the testing and surveillance and then start the isolation of patients and quarantine. The advantage of those is that you can actually test one person and get results very quickly, and then you can decide whether to extend to the family if you think that there's a need at that point. So we're hoping to get all of those. We have actually said our SAPRA must work 24 hours to make sure that we can get all the information so that these tests should then become available. They're not here yet, but they should be coming soon. But whilst they're not here yet, we actually have these particular tests that are going on now. In other words, rather than waiting for the patients to come to the hospital, we're now going to go out and look for and find the patient. That's the message of these vans going out. So we will be focusing on dismantling the infection cycle by proactive action than the reactive approach that we have adopted up to now. In other words, we're combining now, the initial strategy was a defensive strategy, where you get the patient attacked by the virus, then they report and then we test them. Now we're going to go on an offensive strategy, where we suspect where the virus could be. We find everyone and check if they've got the virus and deal with it before actually people even present themselves. So there must be very clearly defined district and sub-district level structures with a clear short command line, which is led by experienced professionals, which will take clinical decisions quickly on how to deal with the patients on the spot. So we need experienced leaders on the ground. Secondly, we need to procure additional beds and dedicated treatment centers where COVID-19 will be treated in every town. So every town now must begin to prepare for, in case we do get patients coming into those particular areas. We also need to make sure we find more quarantine beds so that people who have got a situation under which they live, which is not possible to quarantine at home, they should actually be found into places where it's possible to be able to be quarantined. So we'll be getting reports tonight how far they are going. We're not necessarily going to be reporting that to the media, but this is just our normal approach. So that every province now must identify health professionals who must be earmarked to focus on these COVID-19 teams. We'll also be seeking reinforcements from some of the countries that might be able to assist. For example, we have approached the presidency to approach China and Cuba to actually assist with reinforcements. So hopefully those in the next couple of weeks, we should see some of them coming to reinforce. The advantage of China is that they've just gone through the same, so we'll actually be wanting to use that experience. But the advantage of Cuba is that their community and district health model is actually one that we'd like to use because it works for instances where you'd like to be able to reach out to many communities and ensure that there's a good cover at community level. So we're encouraging also, and this is the issue we're going to discuss tonight, we're encouraging that the institutions should release from hospitals patients who might be easier to treat on outpatient basis. This will assist to reduce hospital loads, but at the same time will also reduce the risk of cross-infections. So we're going to also be encouraging, asking all the clinics and the hospitals to provide daily COVID-19 tally. Did they suspect any patient today? Did they get one diagnosed today? And talk about how to manage that so that we bring that as part of the daily management of our patients. So all the treatment and PPEs that's going to be needed for the next few weeks, we're asking that the departments, various provinces must try and procure so that we've got enough stock as we move forward. We are aware that there are challenges of the stock right across because everybody in the world is looking for the same stuff. So we've given allocations in terms of kind of guide in terms of provinces to say they need to increase and make sure that they've got capacity for so many thousands additional new beds so that we give them guidance on that. Those are some of the issues we'll be discussing tonight. I think based on the current observations, we actually think that we're seeing the mortality has started picking up, and therefore we think that the numbers, the numbers that we are seeing, we mustn't expect them to come down immediately. We must therefore make all the health workers to be focused on the fact that there's that pressure that we are seeing. We'll obviously look at the scientific models. There's quite a lot of modeling that we are doing, but we only deal with that when it comes. But at the moment, we're using basic observations in terms of what we see as a trend. So this, what I've just shared with you, is not all what you would have got from the models. It's just observations as we see the situation, and therefore discussing amongst ourselves as the leaders in health and in government. So we are saying to everyone that everybody needs to move at a faster pace, because there's not much more time. We must just be ready for whatever then happens. As we say, we plan for the worst even if we hope for the best. And in this case, we're actually saying everyone is to move on and make sure that we are able to give all the plans, start with the plans and making sure that they get implemented. So, but most of all, it's important to remain focused and to be courageous, because in the midst of any kind of crisis, the worst you want to see are leaders who are anxious and disorganized. In this case, we actually have to face up to the fact that this COVID-19 is rising in all the countries, and we can't see ourselves as different unless we do the basics that have made other countries to succeed. And therefore, we still want to send the message to our people all over the country that the message that has been sent by President Ramaphosa about people staying at home is still very important. The message of ensuring good hygiene is still very important. The message of social distancing still remains important. The message of making everybody understand that this is a problem for everybody. Any kind of thinking that if you is for the rich people or for the poor people is misled. The third one is misled. If anybody thinks there's a disease for the black people and not the white people, or not for it's for the white people and not the black people, again, those are misled. Those who think that it's a disease you'll only find in township, informal settlements, and not in suburbs, or the other way around, that you only get it in suburbs, again, those are misled. This disease can be anywhere, and it can get anybody, and therefore it's important for us to face up to the reality that we can be able to defeat this infection if we work together. If you look at the history of the various countries, as I was saying yesterday, the history of China is very, very encouraging. They were like the West in the world. They are now the number 4 and slowly getting to be less and less of the important epicenters of the infection. If you look at South Korea, they were number 2 at the beginning. They are right down at number 13. But America was nowhere. When China was running around 50,000, America was somewhere. They probably got about 176 cases. That was about a month and 2 weeks ago. But the number now has gone to over 120,000. That means it is not necessarily the infection and the conduct of the COVID-19 that matters. It is the conduct of the community, whether we can be united, whether we can follow the guidelines, whether we can work together, whether we can be focused in dealing with this issue. And I think therefore the message that goes to everybody is that we need to take the issue seriously. Not that we must panic, but it means we must not be complacent. So as we look around, we do expect people to be staying at home. Just go out for the essentials, go out and get the basic necessities, the food, and so on. Because, of course, the one thing we would like to see, people can't save themselves from COVID-19 and still die of hunger. So it's important for us, as President has said, we must allow the food supplies to be allowed through. All of these are important for our people. But we must be able to use the 3 weeks that has been allocated for a lockdown. And I want to say that there is possibly an impact, but the impact is not irreversible. The impact is also not actually at the point where we can say we have now dealt with the infection. It means that there are things we can do to change the course, but it's too early to say. And therefore, we mustn't be misled. We must still remain vigilant. We need to understand that for the situation to turn the other way, we may not get any other warning. So whatever warning we've got now is important, is enough, but we can still fight this infection and defeat it. It depends on us. It doesn't depend on COVID-19. It doesn't depend on coronavirus. It depends on what South Africans as a nation can do. Thank you very much.
Yes, indeed, a round of applause. It is all up to us. Every single South African can make a contribution towards this fight towards COVID-19. I'm going to ask Dr. Masuku if you would like an opportunity, or has Minister covered you completely? Dr. Kamachiti, you're not going to make any comment? Okay. Right, so that then brings us to the question answer session. We take rounds of 5 at a time, please. I had a hand up here. I had number 2, 3, 4, 5.